metrics. Experts in their field will share ways to utilize this knowledge in your dental practice. Casey Jones, DMD, first. Dr. Jones. Dr. Jones is a whole health dentist, breathing instructor, former professional dancer, person of faith, wife, mom, and more. Wow, you're everything. Her own dysfunctional breathing is driving the journey as she shifts her focus towards sleep wellness. Her story may inspire you to make the shift yourself. Thank you.
We can go weeks without eating, days without water, but we can only go minutes without breathing. If breathing is that important, should we be paying attention to it? We breathe all day, every day. In fact, we take about 22,000 breaths per day. But do we ever actually stop to pay attention to how we breathe? How we breathe matters. I want you to take a minute to breathe with me. Put your tongue to the roof of your mouth, lightly touch your teeth together, close your lips, and breathe through your nose. I want you to inhale, 2, 3, 4, hold your breath, 2, 3, 4, gently exhale, 2, 3, 4, hold your breath, 2, 3, 4, inhale, 2, 3, 4, hold your breath, 2, 3, 4, lightly exhale, 2, 3, 4, hold your breath, 2, 3, 4. Now continue breathing in this way as I talk. This simple box breathing exercise is traditionally used by military personnel in order to balance both the parasympathetic and the sympathetic nervous systems. It's meant to make us feel both calm and alert at the same time. How we breathe can affect our emotions and vice versa. Imagine how you breathe when you're scared, anxious. It's up in our chest, it's rapid, it's often through our mouths. Essentially like we're hyperventilating. Now, what if I told you that many people were breathing in this way, essentially chronically hyperventilating or breathing more air than they need to, all are part of the day, and that this dysfunctional, inefficient way of breathing was not only affecting their mental wellness, but it was affecting their oral health and their overall health. Several years ago, we had a new young team member come on, and our protocol was to do a complete exam, not only so they could get the care that they needed, but so that they could communicate that experience to other people. We started to go through her medical history, and it came up that she was suffering from horrible headaches almost every single day. I had no idea that she was having this chronic pain because she was so high functioning. So I started to do the exam, and I noticed some signs that she might be mouth breathing. She had a drier mouth, stickier plaque, a few cavities, and that very characteristic localized anterior gingivitis. So I asked her, do you breathe through your mouth or through your nose? She had no idea. So I asked her to start paying attention, and I started looking. I would see her across the table at the morning huddle, and I would notice that her mouth was open. I also noticed that she was sighing and yawning frequently, which can be our body's way of tricking us into breathing more air than we need to. I made her aware of the habit. She closed her mouth and started breathing through her nose. Simply by switching to nasal breathing, she was breathing less air. These holes are smaller than this hole. And so her mouth was less dry, so her decay risk lowered, and her anterior gingivitis resolved with a little oral hygiene coaching. But most importantly, her daily headaches went away. Such a small change that was able to make such a big impact on the quality of her daily life. Closing her mouth and breathing through her nose. The nose is amazing. It warms, humidifies, filters, and disinfects the air. And let's face it, the air that we breathe is not clean, so it has a big job to do. The mouth was not designed to breathe. Yes, it's a big hole that air can enter through, but the only thing available to filter that same dirty air are our tonsils, and they work hard trying to do it. In fact, they work overtime, but they get bigger as they do, and they start to obstruct our airway. Now, we as humans do not need anything making our airways smaller because we're already growing smaller airways due to evolution and epigenetics. Our diets are softer, so our muscles are just not working as hard to chew, and since form follows function, our jaws aren't growing in the same way. We also have so many people that are chronically mouth breathing, especially children, and this open mouth posture is causing us to grow longer, more narrow faces, and for our jaws to grow down and back instead of forward. Our airways are back there, so that's making our airways even smaller. With the longer faces, we see more narrow arches and high vaulted palates. And since the roof of our mouth is the floor of our nose, that literally means that our noses are smaller, making it harder to breathe. Now imagine these already smaller airways, think straw instead of garden hose, getting even smaller as you fall asleep and the muscles of the pharynx relax. All of a sudden, it's like trying to breathe through a coffee stirrer, or worse, a kink in the hose closes things off completely. So many people that are struggling with dysfunctional breathing during the day are suffering from sleep disordered breathing at night. These people are struggling to breathe. They're breathing hard, and this is causing acid reflux, which is why we sometimes see signs of erosion on the teeth. We also often see signs of clenching and grinding, like worn, broken, chipped teeth, fractions, recession, because the body is smart and it will try to find ways to adapt. So it brings the jaw forward, almost like doing CPR, in order to be able to breathe. The teeth get in the way. It also might try to push the tongue up and out of the airway to be able to breathe, but if there's no room, we'll see scalloped tongues. One thing's for sure, breathing and sleep were never meant to compete, and both are important. If we don't breathe, we die. So we hope that breathing wins every time. But if it's at the expense of quality sleep, it's like an explosion that affects every system of the body negatively. I see these negative effects or symptoms as I'm going through the medical history, like type 2 diabetes, acid reflux, heart disease, thyroid issues, anxiety, depression. And I see the signs as I'm doing my oral cancer and airway screening. And I start to open the conversation by saying, has anyone ever told you that you snore? And I might follow that up with, have you ever had your sleep evaluated? 80 to 90% of people who have sleep apnea are undiagnosed. So there's a reason why I feel like I open this conversation with almost every patient. But let's face it, this is a big conversation to have, and that takes time. So what if we empowered our team members to open these conversations? Reimagining the recall hygiene visits as an oral health coaching session where they were not only able to recognize the signs and symptoms of dysfunctional and sleep disordered breathing, but able to teach some functional breathing exercises along with their individualized patient-centered oral health coaching. Or an assistant who was able to teach this to a child both before and after palatal expansion. Or to an adult as part of mandibular advancement device therapy to treat sleep apnea. We can fix the structure through various nasal surgeries, tonsil removal, jaw surgeries, but here's the thing. Even if we fix the structure, it's not magic that then people know how to breathe through their nose. I wish it was a part of all of these structural interventions to teach people how to breathe functionally through their nose. Imagine how much less relapse we'd have if the tongue was in the roof of the mouth and the lips closed to use the muscles to keep the teeth in the right place. Tonsils can grow back if the mouth breathing habit continues, but are parents often told that? What if breathing was as important as oral hygiene and diet to oral health and one of the keys to overall health and mental wellness? What if it was as simple as becoming as common as coughing into our elbow to learn to breathe through our nose? What if oral health providers like yourself could be at the forefront of implementing this change? More people are breathing dysfunctionally than we realize. Let's inspire wellness.